Today on Ahead of the Curve, looking inside the human body, waiting room gadgets, and meeting your job match. Now, one doctor hopes to turn that habit into better medical care. As Brad Kloza explains, a new waiting room gadget may be on the way to get reluctant teens to communicate with their doctors.
For teenagers, waiting to see the doctor means dreading questions from another privacy-invading adult. But avoiding certain topics with doctors can hurt teens' health.
Many of the problems that children and adolescents face are not easily detected in a very brief primary care visit that might only be once a year.
Enter pediatrician Kelly Kelleher and his Health eTouch system. Developed at the Nationwide Children's Hospital in Ohio, the eTouch gives waiting room patients the ability to answer personal and medical questions on a computer screen, a familiar experience for most teens. The information is sent directly to their doctor, who can then identify high-risk behaviors and evaluate the patient's problems without an awkward question and answer period.
Socially undesirable behaviors like drug use or high-risk sexual activity or even crimes are much more likely to be reported when we don't have to face people directly and say those words.
As he wrote in the journal Pediatrics, Kelleher found that doctors who received information about their patients before seeing them were over 2 times more likely to actively address the concerns of adolescents than doctors who had received the information a few days later.
Physicians, when they're given good information, the information that's hard to get from children in a normal visit, are very much more willing to start to work with those teens and trying to address those behaviors.
And aside from improving medical care, Kelleher thinks the eTouch might also make the waiting room a little less boring. I'm Brad Kloza.
That was Brad Kloza from Science Central. Coming up, a new site to help you meet your job match.